Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 197. Welcome to All About Breastfeeding, the place where the girls hang out. I am your host, Lori Jo Eisenstadt, IBCLC, which stands for International Board Certified Lactation Consultant. I am the proud owner of allaboutbreastfeeding.com, a private lactation consulting business where moms make appointments with me in my home office, the privacy of your home, your hospital room, and via Skype if you're not local. I've done a few hospital rooms this week and a few Skypes the last couple of weeks. I've really had the wonderful pleasure of meeting several of my listeners on this show via a Skype consult, get to see your babies. And of course, the best thing in the world for me is to help make a difference in your breastfeeding relationship. It's always such a joy for me. It's not that I'm happy that you're struggling, but it's really a joy for me to meet with a mom who's been struggling. Some moms just feel like they just don't know if they can continue. And then with a little bit of work, make a nice difference so that you're back to breastfeeding. I'm also the owner of allaboutmothering.com, your online mothering membership site, where I provide you with specific focused information about the stages between conception and the first year of your baby's life. You can always go to www.allaboutmothering.com to find out more about that, and allaboutbreastfeeding.com to find out more about Skype consults and other services. In our last show, as part of this season's FAQs, I have a theme going on called Birth Matters, meaning birth can have a direct impact on your breastfeeding experience. Whether it is where you birth, how you birth, when you birth, and with whom you birth, birth matters. All of this can have a direct impact on your breastfeeding experience. And I find that some people just don't really think much about that. But like I said, where you give birth and how you give birth, it can have an impact on how things go with breastfeeding right after the birth. So with that being the main theme, each week we're going to have a subtopic. Last week, if you remember, we talked about how a postpartum hemorrhage can affect milk supply for some moms. In today's show, we will talk about babies who are born too early. We'll discuss premature babies, near-term babies, or what the American Academy of Pediatrics is now using the term late preterm babies. And if you stick with me through the whole show, there's a lovely gift at the end that will be quite meaningful to all my listeners, but particularly those who have recently given birth to babies well before their 30th week gestation. It's for you, and it's for anybody who knows of parents who have given birth before the 30th week. You will have something to share with them. Now, if you're anything like I was, there comes a point in your pregnancy where you're like, if the baby wants to come now, I will be totally fine with this. Or better still, if you do what I did, especially with one of my babies, I start making deals with the baby inside and say, if you come out now, I promise to buy you whatever car you want when you're 16 years old. As uncomfortable as you are, though, what I really want you to know is once you start learning about feeding complications, along with health complications for babies before the 37th week, you're going to be begging your baby to stay in longer. You don't want to wish that they come and enter the world a little bit earlier, because it does raise the risk factor for quite a few complications. What I'd like to do first is let's first make the distinction between full term, which are babies born between 37 and 41 weeks gestation, and late preterm. It's defined as birth between 34 weeks and 7 days through 36 weeks and 7 days. These babies, well, they're less physiologically and metabolically mature than term infants. Thus, they are at a higher risk of morbidity and mortality than term infants. So the thing is, they're often about the same size and weight as some term infants who were born between 37 and 41 weeks. But because of this, late-term, preterm infants may be treated by parents, caregivers, and healthcare providers as though they're developmentally mature, when in fact, they are at an increased risk for complications. They need to be evaluated on an individual basis and, if necessary, suggest guidelines to identify and manage possible complications for them. Now, babies who are premature are infants born before the 37th week gestation, and they may be at risk also for complications. This affects more than 1 out of every 10 infants born in the United States. Now, advances in medical technology have made it possible for infants born as early as 23 weeks gestation. That's 17 weeks before they were really ready to be born. But the advance in technology has made it possible for more and more of these babies to survive. Now, they're surviving, however, they tend to be at a higher risk for death or serious complications. And some of the common ones are heart defects, respiratory problems, blindness, and brain damage. Before we go further, I want to say that I'm not a physician. I'm not giving a lecture on the risk factors that are specific to premature and late preterm babies, and not going to go into detail about how we evaluate and differentiate the two. I will leave that for the specialists. But this is more of a broader look at babies who are born before the 37th week, and to talk about the challenges they face with regards to feeding in general and how this affects their ability to breastfeed. Along this same line of thinking, I'd like to say that it is for the purpose of this show, I'm going to use the term premature babies most of the time, and at other times perhaps highlight the difference when I need to make a point. It's just easier. There are some common problems that premature and late preterm babies have, and they are: number one, they're at higher risk for jaundice. They're also more prone to be diagnosed with apnea, which is the absence of breathing for more than 20 seconds. And this can also occur in full-term babies, but it's more common in premature babies. And the more premature the baby, the greater the chances that apnea will occur. And apnea will frequently be followed by bradycardia, which is a decreased heart rate. These babies are also more likely to have difficulty regulating their body temperature, their blood pressure, and their heart rate. And also, their lungs, their digestive system, and nervous system, including their brain, are underdeveloped. Therefore, this makes them more vulnerable to complications. When babies are born full term, these problems make it difficult for them to have good feedings on their own, so they will frequently need help, at least until they're feeding well on their own. Now we're going to get more detailed about how these risk factors leave your baby more vulnerable and how this in turn affects your breastfeeding relationship. Let's first start talking about one of the most common complications of prematurity, and that is jaundice. And this is a very common condition in newborns, and it refers to the yellow color of the skin. It means that they just have too much bilirubin in their blood. And I spell bilirubin, Bilirubin. It's one of those words that if you don't know what it is, I like to spell it for you because you might want to do further research on it. Bilirubin, well, it is produced by the normal breakdown of red blood cells. Normally, it passes through the liver, which releases into the intestines as bile, which is a liquid that helps with digestion. Now, jaundice happens when the bilirubin builds up faster than a newborn's liver can break it down and pass it from the body. And just to be clear, I'm talking about basic jaundice in the newborn because there's other kinds of jaundice, but this is just basic jaundice. And it's typically the excess red blood cells. What they do is they bind with the stool, and that's how the body rids itself of all these excess red blood cells. We want your baby to be feeding frequently because this helps give them plenty of colostrum. And we know that colostrum has a laxative effect. And so what happens here is that the milk binds with the bilirubin, so the colostrum binds with the excess red blood cells, and that is excreted through the stools. So premature and some preterm babies are more susceptible to jaundice because their digestive system may not be fully developed, and this may make them poor feeders, and this makes for poor elimination. This makes the passage of meconium, the first stools, slower, which increase circulation of those very same blood cells that we need to be excreted. Babies are born with large amounts of red blood cells needed for fetal growth. That's exactly what should happen. But after birth, too many red blood cells, because of difficulty eating and eliminating them, is what causes jaundice. Because of underdeveloped digestive systems, poor feeds, premature and later term babies are at a greater risk of jaundice than full-term babies. If full-term babies are also feeding poorly, they can still get jaundice. The excess red blood cells, while they circulate freely in the blood system, and they can be deposited, it's like they're attracted to the brain, skin, muscle tissue, and mucous membranes. They can pass the blood-brain barrier, and this causes them to have a toxic effect on nerve cells in the brain. So this is the big worry because this can be very dangerous. So we want to be sure that your babies are receiving enough fluids to help with proper elimination. Because the colostrum has a laxative effect and helps babies to stool and helps eliminate excess red blood cells, we really want your babies to be feeding well. So perhaps you can begin to understand the importance of recognizing a late preterm baby and the need to evaluate this baby. We would want to follow closely to ensure that they're getting enough food. We want to evaluate their feeding behavior to rule out any issues with regards to a weak suck or a poor suck or little to no interest in breastfeeding. We really would not want parents to assume that they have a good baby that sleeps well with a baby that's a little too sleepy for our comfort and not feeding well when awake. Premature babies may still have breastfeeding challenges. However, when properly evaluated, parents can be given accurate information to ensure they have a well-fed baby. You'll need to be more vigilant about feeding frequency with a premature baby and recognize the fact that you may not be able to follow a baby-led feeding style, as this is when you totally let your baby decide when it's time to eat, when they give you those hunger cues. When you have a baby that is sleepier and less energetic, you have to have a more parent-led feeding style, at least until your baby's old enough, strong enough, and feeding well on their own before you can rely on their cues. Some other complications with premature babies: respiratory distress syndrome, necrotizing enterocolitis, intraventricular hemorrhage, apnea, patent ductus arteriosus, and retinopathy. And we're going to take those one by one. So, respiratory distress syndrome, often you'll hear people refer to it as RDS just because it's easier. The most common problem with RDS is that babies who have immature lungs, they've not developed a protective film that helps air sacs in the lungs to stay open. This is called surfactant. Extra oxygen can be supplied to the infant through tubes that fit into the nostrils of the nose or by placing the baby under an oxygen hood. Sometimes a baby may receive air from a respirator or ventilator. Being like this can make it difficult for a mom to work on breastfeeding. She may not be able to try for hours, for days, or for weeks, depending. When she does, it's for a specific period of time, which usually is quite limited. NEC, necrotizing enterocolitis. This is when part of the baby's intestines are destroyed as a result of a bacterial infection. It can be fatal if not diagnosed and treated quickly, and this is one of the risk factors for babies who are born too early, is to possibly be more susceptible to necrotizing enterocolitis. Intraventricular hemorrhage, or IVH, and this is a condition which immature and fragile blood vessels within the brain burst and bleed into the hollow chambers normally reserved for the cerebrospinal fluid and into the tissue surrounding them. Apnea. This is a condition in which the infant stops breathing for periods up to 20 seconds. It's also often associated with a slowing of the heart rate. Some babies need medications to stimulate breathing, or they may need oxygen through a tube inserted in the nose or be placed on a ventilator. Patent ductus arteriosus. Now, this is a condition in which the duct that channels blood between the two main arteries, it doesn't close after the baby's born. Normally, this bypass duct closes within the first few hours after birth. However, in premature babies, they are at a risk for this to not happen. Premature babies are also at a greater risk to have retinopathy, which basically is a condition that results in blindness. You may remember one of my running themes for the All About Breastfeeding show is to bring you information to help you make an informed decision and to not shy from bringing you the hard to hear stuff. I've said that before, but I think it's just a good idea to remind you because I know the show is getting a little heavy again. But you know what? This is the stuff that no one wants to talk to new parents about because it's scary. And it kind of makes everything sound gloom and doom. Who wants to hear about darkness during a time when we're happy and looking forward to a healthy, full-term baby and a wonderful, joyous parenting life? None of us really wants to hear about all this hard stuff. And yet, knowing the statistics, I take a different stance on this than the next person perhaps. While I do agree that dwelling on this information is definitely not helpful, I do feel strongly that parents need to hear this information just so that you have an awareness that premature births do happen. You will not be totally taken off guard. You will have some knowledge and some tools in your toolkit to help you through the early days. Here are some recent statistics, ones that help motivate me to talk about this, and they come from the CDC, and it supports why I think the subject of premature birth deserves more than just a little mention or no mention to pregnant parents. The preterm birth rate rose slightly in 2015, and about 1 out of 10 babies, which is 10%, were born too soon in the United States. Additionally, racial and ethnic differences in preterm birth rates remain. In 2015, the rate of preterm birth among non-Hispanic Black women, 13%, was about 50% higher than the rate of preterm birth among non-Hispanic white women, 9%. The full report is linked in the show notes for today, and it's filled with a lot of great information, including what you can do and what activities the CDC is engaged in to help reduce preterm delivery and complications. We are also reminded more than ever how important it is that our smallest babies have access to human milk, as they are more susceptible to infections, particularly of their gut. I, of course, am always fascinated by all the scientific details about human milk. Here is one I think that you'll find of interest. Studies have shown that the milk moms with premature babies produce is more rich in proteins and has slightly different fats that are easier to digest and be absorbed than later breast milk. It's specially designed to help a premature infant through those first difficult weeks. There are differences in the minerals and iron in preterm milk than in term milk. Preterm babies fed human milk are less likely to develop intestinal infections such as NEC, the necrotizing enterocolitis, like we talked about. Premature infants, well, the studies show those who receive human milk have the best outcomes medically, nutritionally, and developmentally. And yet, the struggles can range from minor to difficult in getting your baby to take your milk. So, what can you do to help yourself and your baby? How can mothers maximize their breastfeeding success when you're separated from your baby who's spending time in the NICU? Well, more than likely, the hospital staff will have a team of specialists to help guide you. Do not be shy. Utilize this team of, yes, admittedly, they are strangers to you now. However, they will soon become near and dear people to you. Many parents have told me that the staff becomes their lifeline. I know of many NICU staff who they're the main reason parents can make it the next day with their sanity intact. Giving birth early, particularly well before the 37th week, is a shock to your system. You were not physically or emotionally prepared for this. Because of all the well-known and documented health benefits of human milk, more hospitals are accessing and encouraging parents to use donor milk if mom is not able to collect enough milk for her baby. Just yet. More hospitals have partnerships with milk banks now more than ever. You can find this out ahead of time just by asking them. I've interviewed Julie, and it escapes me what episode number it was, but I will put it in the links afterwards. This is a 2-part interview, and the interview I did with Julie is a wonderful testament to a group of people who understand the importance of human milk for human babies, and in particular, the importance of human milk for premature and sick babies. It's a small group of mighty motivated people who worked hard to open the doors of the New York Milk Bank, and you will really enjoy their story. Let's see. Okay, I found it. It's episode number 114, and that is part 1. And the second part is episode number 117 with Julie Boucher Harwitz. And she is an IBCLC, part of a team of people who opened up the New York Milk Bank. I think you're really going to love that show. So what are some of the ways that your baby can drink your milk? Well, you're going to hear me say a lot now, well, this depends on many variables, but it is true. Your baby will need to be evaluated on an individual basis. Remember that you are your partner in your baby's health care, and you will request to be updated every step of the way and part of the decision-making process with your baby. How early can your baby breastfeed? Again, many variables. Because this depends on their diagnosis, are they sick, what gestational age they're at. If all is well, you will be encouraged to try breastfeeding between perhaps 31 and 33 weeks, because developmentally, this is when a baby can begin to learn how to suck, swallow, breathe, which is what happens during breastfeeding. Some babies who are born really early have limited or reduced sucking pads. You'll also hear them referred to as cheek pads, fat pads, or buccal, B-U-C-C-A-L pads. And these buccal pads, they're important. They develop towards the end of pregnancy when other fat is forming on the baby's body. The buccal pads are really important to breastfeeding. They help a baby attain pressure needed within the mouth to properly feed. Without use of the buccal pads, babies tend to tire easily at the breast. They do interesting things with their tongue like thrusting or biting down. Your lactation consultant can share some techniques that will help you with this though. Your baby may prove everyone wrong and actually breastfeed quite well, and this is what I tell moms all the time. You may have enough milk and your baby may be strong enough to transfer a full feeding right away and not be supplemented even when others thought they couldn't. If not, you will be encouraged to continue working on breastfeeding, supplementing, all while you are doing very important work of pumping on a regular basis to build and increase your supply. Even if your baby is breastfeeding well during the day and yet still needs to be in the NICU at night, but you can't be there 24/7, your baby will more than likely be bottle fed your pumped milk when you're not there. More variables here in this situation. Perhaps you have other children at home to tend to, and you can't stay 24/7. Perhaps you have your own healthcare concerns that preclude you from spending significant time in the hospital once you're discharged. You may not have transportation. You may not be able to drive yourself yet, and you'd have to wait for another adult to drive you back and forth to the hospital. So there are various reasons why your baby who may actually be breastfeeding well may not be able to get all of your milk directly from the breast. Another scenario could be that your baby is not strong enough to bear breastfeed, but does really well with a nipple shield, which is a silicone teat placed over your nipple that can make it easier for your baby to transfer milk. In this case, you will perhaps not need to supplement at all as your baby is strong enough to get a full feeding. Perhaps your baby does well, but tires easily, transfers some milk, but not enough before tiring, and may still need to be supplemented. You're going to keep pumping if your baby's using a nipple shield and or needs to be supplemented. Please note that once evaluated on an individual basis, the recommendation may be different than what I'm suggesting commonly happens. This is also frequently, I tell parents, a fluid plan that may likely change from day to day or every few days based on the variables: your supply, your health condition, your baby's medical condition, and your ability to spend time with your baby. Also, your hospital will have protocols. Please ask your nurse to help you familiarize yourself with the most up-to-date protocols. Don't be afraid to speak up and ask questions. This can be frightening for you. The baby is in their nursery, but you are the parent. The NICU environment can be intimidating to some of us. However, remember, you are the parents, and it's okay to ask as many questions as you need to. If no one tells you otherwise, inquire if your baby is a good candidate for skin to skin for early breastfeeding tries. Some decisions will be made perhaps with mom's health in mind. Perhaps there was significant birth trauma for the mom, and she needs to take care of her medical needs, which may not necessarily jive with her ability to spend time in the NICU breastfeeding. Her health issue may also conflict with her ability to pump immediately. And the reason I'm bringing this out is because I speak to parents and, some will say that they were annoyed or angry because their friend who gave birth in the same hospital with their baby who was about the same amount of weeks, the nurses let them breastfeed. And I just tell them that, there might be different variables going on that perhaps you were unaware of. And or you may definitely have a leg to stand on, which is why you want to have some knowledge of what's going on, understand the hospital's protocols and policies with babies in the NICU and breastfeeding, and, just really make it your business. And again, just say, I'm the parent. I need to know, and I can ask as many questions as I need to. And I say that because I've also worked with enough parents who say, well, they realize after the fact that they were just kind of shy or intimidated and the environment was scary. And the NICU staff, they really can be your lifeline, so use them. When supplementing, the method used is typically based on what your baby can manage. Some of the most common ways are to be either gavage, we spell that Gavage, gavage fed, and this is when a tube is placed through your baby's nose, which carries your milk to your baby's stomach. It is often referred to as a nasogastric feeding, or NG for short. They could be syringe-fed, cup-fed, spoon-fed. Milk is put in a syringe or a cup or on a spoon and fed to your baby, with the user doing their best to provide a paced feeding so your baby does not drink too much too fast. And again, I imagine that you're going to have a staff member in the NICU show you how to do this. Your baby may also be able to be put to the breast and breastfeed with an SNS if the volume of milk you have is not yet meeting your baby's needs, but they're actually doing a good job suckling at the breast. An SNS stands for the Supplemental Nursing System, and this is a container and a tube leading from the container to the mother's nipple. The SNS container can be filled with your milk, with fresh donor milk, or if need be, with formula if there's no other milk available. I'll post a picture of an SNS in the show notes as an example. So we got a lot of links in the show notes for today that you're going to want to check out. Your baby may be bottle fed. Your baby may show signs of readiness to feed from a bottle, which of course can have your milk or donor milk in it. You may start off with one method, and then as your baby grows and matures, you may move to another method, perhaps several different ways of feeding your baby before you're able to breastfeed. You just need to be open to it. My hope is that you will have an IBCLC as part of your team who will meet with you and suggest a care plan and ensure that you have all the tools you need to follow the care plan. Information on hand expression if need be, that you be given information on pumps to use, how to use the pump so you'll pump effectively and comfortably, or how to use any other tools like nipple shields or supplemental nurses systems that you're given. And also, let's not forget the power of skin to skin. It doesn't cost anything, it doesn't take much effort, and it does a world of good to keep your baby warm and tucked in close to you. You will want to request as much skin-to-skin time as your baby is able to, because this provides so many benefits to you and your baby. Moms have reported being able to pump more milk than usual when they pump right after skin-to-skin time. If your baby can, but you cannot, have skin-to-skin time, perhaps your partner can provide skin-to-skin with your baby. This really helps to reduce their needs for oxygen, helps keep them more stable in other ways too, helps with blood sugar levels, they breathe better. If they need to be on IVs and oxygen therapy, they can spend some time skin to skin, and with this, the NICU staff will definitely help you to navigate this. You may also want to use a hospital-grade electric pump if your baby is unable to breastfeed. Sometimes the hospital-grade electric pumps do a better job than the single-user pumps, and they're more comfortable. And so your breasts do need frequent breast stimulation, either by hand expression or a pump. Having given birth earlier than expected, it just puts so many moms and babies in a compromising situation. You just need to request and accept all the help you can get. Ask your healthcare provider for referrals to groups in your community. The help and support of your family, physician, and support group is going to be really important in helping you during this time. As I write my notes for this show, I'm sitting here thinking, I really hope that no one listening to this show ever really needs this information yourself. And yet, I know the statistics. Statistically speaking, some of you will. Or you will know someone else who needs this information. As always, my hope is that I've provided you with good, solid information to help get you started. As you can see, there's just way too many variables for me to be specific about your premature or later preterm baby and how breastfeeding will go. There's a lot that you learned today. One of them is the distinction between preterm and late preterm babies. Knowing that you have a late preterm baby will help alert you to their possible breastfeeding challenges and adjust feeding plan accordingly. This is real important. You'll realize that there might be a good reason to perhaps supplement, even though you probably don't want to. But if your baby tires easily or lacks the buccal pads to suck properly or has lost too much weight because of poor feeding, now you will understand why and the rationale behind the suggestions. And you're going to understand what the NICU team is telling you, and it will make more sense. You'll understand why the need to practice parent-led versus baby-led feedings. You will understand better why you will need to make adjustments before you're exclusively breastfeeding. You've also learned what jaundice is and that this is a common concern with premature and late preterm babies. It causes babies to be tired easily, which causes them to feed poorly. This lack of intake is what I call not enough breast milk, particularly stooling, which is what we need for your baby to do to reduce the red blood cells in their system. This will not happen the way it needs to if they're not getting enough breast milk. They may not be getting enough calories and hydration, and this causes excessive weight loss, which in turn causes a baby to tire easily at the breast. Many times there's lots of good reasons for the decisions made in NICU about your baby's feeding plan. When parents don't understand it and are very anxious to breastfeed, they sometimes become more frustrated and anxiety-ridden, more than you really need to be if you just understand why. So I hope this information helps reduce your fears and aids you in being proactive and positive during trying times. In today's show, you've also learned that some babies are born with a weak suck. They're missing fatty cheek pads, high jaundice levels makes them too sleepy to have a good breastfeeding. They have immature lungs and underdeveloped digestive systems, and you've learned how this can affect your ability to breastfeed at first. Heart, lung, digestive, swallowing issues, infections. Birth matters. Giving birth early does create breastfeeding challenges. And yet, having said that, mothers and babies amaze me all the time. I have long ago removed the word can't out of my vocabulary when working with mothers. There have been way too many times when mothers and babies, they've proved me wrong. There are also babies who amaze us and do things we would just not have expected them to do, like have a decent suck, transfer milk better than we would have expected based on their gestational age, and that shocks us, but always in a good way. Another thing to mention, while babies have their own set of problems and complications, moms have their own too. You need to surround yourself with positive, knowledgeable professionals, friends and family who will be encouraging you to work towards the goal of direct breastfeeding and be there to help you through dealing with the heavy workload you will find yourself in as you're doing all that is recommended to keep up your supply. And I've had quite a few Skype consults with moms whose babies are in the NICU because they do need that help and support and encouragement and knowledge on the outside too. Through it all, it's not uncommon for moms to have struggles such as inadequate milk production, feelings of vulnerability, and we talk about all this in our Skype consults. The lack of confidence that you may feel. You start to feel bottle feeding is convenient and you don't have an anxiety with it. And some moms are kind of looking the opposite way from breastfeeding after a while. You also have a hardship. Pumping and storing milk becomes a lot of work. You may also be lacking emotional and informational support and dealing with extreme fatigue. You may have heard of skin to skin and the importance of it, but now you really know how helpful it can be for premature babies and moms. NICU parents need to adopt skin to skin as one of your superpowers as a NICU mommy. Your love, your heartbeat, your warmth, your voice has extraordinary powers that can calm your baby, help your baby breathe better, provide just the right warmth to your baby, and help them regulate their blood pressure and heart rate better. I would say those are superpowers that both you and your partner have. Never underestimate the positive force of these superpowers. A special note to family and friends and coworkers of the NICU family. Take time to ask the family, what can you do to make their day easier? Rather than say, if you need something, just ask them exactly what it is they need. If they don't know, or you can't ask them, take up a collection of money with friends or family. Believe me, they will be really grateful, extremely appreciative, and definitely put it to good use. They will use it towards meals when they can't cook themselves. There's no time for that. Maybe a house cleaner. They just have not been able to get to household chores for weeks on end. Transportation, if that's lacking, some money can help them get back and forth to the hospital. It can also, for some people, replace sick days when they run out of sick days at work. I hope that I've achieved my goal of letting you know that if you do give birth early, you can still breastfeed. The road to breastfeeding may be more difficult than you planned. It may take longer than you planned. With a good milk supply, lots of motivation, and a growing, well-fed baby, it is very likely that you will reach your goals. But until then, this mantra, feed your baby and protect the milk supply. This is our mantra for all moms and babies who are having breastfeeding challenges, not just preterm babies. And also know you are not alone. Now, what about that gift I promised you? I believe that we gain strength from others on a personal level through their words, their actions, their energy. Seeing is believing. Knowledge is powerful. It takes a village to help guide you through your NICU experience to the point of coming home. My gift to you is not something that you can get directly from me on this show today. However, it is a gift that I can pass on to you from others, from NICU staff and parents who have lived through a long NICU stay. I have found this great place for you to check out, and you're going to go to today's show notes and find it. You're going to find links to a lot of the references that I made, to the SNS that I made, and you're also going to find links to my gift to you today. And it is a video about something called Spin Mamas program, and that stands for SPIN, S-P-I-N, Supporting Premature Infant Nutrition Program. This is a team of physicians and nurses at UC San Diego Health, and they've developed a whole program. When you go to their site, you will have access to so much information. It's just way too long for me to mention here, but it's great information. The one thing that I do want to mention is that I'm passing this gift on to you, and you will see an amazing video where you will meet Kimberly and her twins who were born at 27 weeks gestation. Baby Riley was 1 pound 10 ounces, and baby Jack was 1 pound 11 ounces. You will follow them through the 33rd week and see their progress as they grow, gain, and develop. Kimberly, their mom, pumped regularly. She was given lots of support, information, education to bring her to the place of learning how to breastfeed with her babies. When you go to the show notes, you're going to click on the link and you will have access to 5 videos that cover Kimberly's journey that highlight skin to skin, her beginning pumping, signs of readiness, babies at the breast, using a nipple shield, bottle feeding, signs of good sucking behavior, position and latch, making the transition to go home. This site is a gold mine. You're going to want to go to www.allaboutbreastfeeding.biz/podcast and look for episode 197. Open up those show notes, and at the bottom, you'll find all of the links that I'm referring to. I hope you've enjoyed today's show, our second in a series titled Birth Matters. How and where and when you give birth can have a direct correlation on your overall breastfeeding experience. Birth matters. One last note. Anyone who knows me knows that while I'm not anal and I'm definitely would not be described as type A personality, there are just some things in life that I learned a long time ago that to be prepared for can go a long, long way. And regular listeners will know that I talk a lot about being prepared, doing the work during your pregnancy for when you have your baby. If you have not checked out or purchased my ebook, don't forget to head over to my website and grab your copy. This show will address some of the important issues related to premature babies and breastfeeding. Combine that with the book that gives you specific tips to help you prepare for having a new baby. It's good for everybody, these tips. It helps you get all your ducks in a row before your baby's born. And I love for moms to have this book and start preparing in your first trimester. When you read the book, you're going to see that there are many activities you can do way ahead of time to prepare for the birth. Many of the suggestions will help ease the strain if you find yourself in a situation where you give birth early. It will also help you concentrate on what's really important and to not be distracted with other things that are quite unnecessary. Anything that makes your life easier is a plus for you. All you need to do is go to allaboutmothering.com, scroll down, and you will see the link for that book. Our next show will be another amazing interview, and then following that will be our third show in this series, Birth Matters. A quick reminder to you, if you enjoy the show, you know my mantra. Please don't let the All About Breastfeeding show be your best kept secret. Share it with others. Look at the great information I shared with you today. Let others know about it so they can benefit from this information. Some people, they're still not too hip to podcasting, and it takes someone like you to literally take their phone, with their permission of course, download a podcast app, search for the show All About Breastfeeding, and download it onto their phone. We're also on YouTube and Stitcher and Google Plus and iHeartRadio. All right, I am going to leave you with today's quote. Take a shower, wash off the day, drink a glass of water, make the room dark, lie down and close your eyes. Notice the silence. Notice your heart, still beating, still fighting. You made it after all. You made it another day. And you can make it one more. You're doing just fine. That's Charlotte Erickson, and I really dedicate this quote to all parents who are struggling with preterm babies, separation, NICU, and a lot of the things we talked about today. You're doing fine, and you can make it one more day. Until the next show, bye-bye.